So the role of exercise is really quite widespread in cancer care. The evidence that we have to date shows that exercise, physical activity, general movement at kind of a moderate intensity and above can be really helpful from prevention of cancer right through to prehabilitation, to peri-operative and treatment-related care periods, and also in the rehabilitation after cancer, as well as for people with long-term effects of cancer and also in later stage cancer in terms of supportive care and palliative care. So it's got a place all the way through the cancer pathway. Exercise doesn't always make the cancer go away. We have some pretty robust evidence for cancers being impacted by physical activity in a very positive way, that it may reduce the tumor burden in a number of cancers, with that evidence being especially strong in breast and colorectal cancer and in a number of other cancers as well. So it does seem to have an impact on improving outcomes. However, there's also a wider outcome in terms of keeping that person experiencing cancer fitter throughout their cancer journey. And that might mean that they become eligible for treatments where if they weren't physiologically fit enough, they might not have been able to go through that treatment pathway. And also in terms of the very unfair burden of later effects that people who've experienced a cancer diagnosis and its treatment incur. And that includes like young people who might have a very good prognosis after cancer, hopefully, but they may suffer from late effects such as neuropathy, such as cardiotoxicity, accelerated cardiovascular effects, and physical activity and exercise can have a beneficial impact in all of those cases. Yes, I do think that exercise is an underutilized modality. Exercise isn't a drug, it isn't a medicine. I think if it were a medicine, we'd have all sorts of trial designs and ways of putting this into a capsule. The good thing about exercise is it's not a drug. In some ways, it really empowers a patient, really no medications can do. So I have conversations with patients on a daily basis where we really hope for them that physical activity can in some cases make the difference between getting a treatment or not, and in other cases help to improve some side effects and symptoms. But for all of those patients, what is one of the benefits of my job, I see the enjoyment that they can get out of being more active, getting back to themselves, getting back time with their family, getting time in nature, or whatever they want to do in terms of exercise. It needn't be in the gym. It can just be general movement. However, a lot of people still don't have access to physical activity. There was a very recent paper this year that looked at the reduction in bed days, for example, and admissions if people have access to exercise. And in fact, the starkest improvement here appeared to be for people with hematological malignancies. So there's a lot of great work being done. And I think in the UK, but also nationally, we haven't quite embedded this yet. And that's somewhere that exercise medicine, as it's termed, but all of us working in that field, from the scientists right through to the allied health professionals, implementing the work in the wards and the communities, can help to educate and empower people.